اسلوب. 爸爸。
Assalamu alaikum, everybody. Is the voice audible? Is the voice clear? Inshallah, we'll shortly start the session in some time. Inshallah, we are expecting more participants, so we'll start the session in 10 minutes.
الدوام عندهم بالخمسة.
حرب هذا ب7 ريال.
Assalamu alaikum. Can everybody hear my voice? Is the voice clear? Okay, thank you so much. Inshallah, now we'll start with the today's topic. It's about basic concepts of research methodology. Myself, Dr. Hajira. I am working in as a team member of Governance and Risk Management Unit in Quality and Institutional Excellence Administration, Tabuk Health Cluster. Just to start with, this is just a brainstorming cartoon. It was published in 1866 at London in Fun magazine. Just understand this picture in which you can see the skeletal with the mortality picture who is depicting a pump who is giving a water supply to the needy and underprivileged children and the poor people. So this, you just understand what is the importance of this picture. At the last, we will get the clarity like why this picture was published and why it is related with the research and how it helped in diagnosis and understanding the disease. Now we'll go back to some history of the research, like how research started, why the research is important, and how it became a pivotal role, important role in the medicine to understand the different problems and diseases, to understand treatment, to understand the preventive measures. Here, this is the Scottish physician who was named as James Lind. And the people who were traveling in the ship for months, they used to get bleeding gums. The disease was called as scurvy because of vitamin C deficiency. But the but this yes. Here in the Scottish physician, he did trials. One group he used many other items like vinegar, other cedar vinegar and honey, everything. And one group he started with the vitamin C rich lime juice, everything. Then after the trial, he could understand the people who had consumed vitamin C rich juice like lime juice, they had been cured with this problem of the scurvy. So this is how this physician, he understood by utilizing controlled trials, by making therapeutic trial of vitamin C rich juices, he could diagnose the treatment here. The deficiency, later he got to know it was because of vitamin C, and later the ship travelers, they were told to consume vitamin C rich juices. So this how it helped to understand the disease, scurvy, and the treatment. Similarly, it was a major breakthrough in the cardiovascular disease identification of the risk factors. This study was called as Framingham Heart Study, in which in 1948, in the city of Framingham, 5,200 people of middle age 30 to 62-year-old, they were studied, a cohort study, any longitudinal study, long follow-up. And over the period of 20 years, and every 2 years, they used to measure their risk for cardiovascular disease and various risk factors like hypertension, obesity, increased BMI, then cholesterol levels, diabetes, all these risk factors were studied, and they could understand the investigation of cardiovascular disease. Many multiple risk factors are responsible for the emergence of cardiovascular disease. So this was very famous study which was conducted in the form of cohort study. Cohort study, it was a prospective study which is starting from the before the emergence of the risk factors and until the disease develops. So this study is very famous, which helped to understand the cardiovascular disease very clearly with the help of this study. And the outbreak of cholera, this also by John Snow, he could just see the spot map here, and he was just analyzing the water supply by two different pumps, and the city where the pump supply was there, where there are no cases. And one more place was there, here where he could see the most of the cases were occurring around the location of this supply of this pump. So he could understand that the source of infection for the outbreak of cholera was this through this pump. So by this spot mapping, just by an observation and by analysis, he could understand the source of infection for the outbreak of cholera by John Snow. Next, this is just to show the example that ethical principles are so important when you are conducting the research, is um, very important, and it is the right of the participant when the researcher is doing any study. When they did this is called as Tuskegee syphilis study, where when the people wanted to study the syphilis epidemiology, pathogenesis, how syphilis emerges, what are its complications, they started the study here among the participants by inducing the infection without having any treatment, without confirmed treatment. So there was more morbidity and mortality among the patients, and later the people protested and they got to know, and there was a question about the ethical principles for conducting this type of study. Then this is you must know there is a famous environmentalist who was called as Jane Goodall. She did major breakthrough in observational studies. by observing just naturally in their own environment, the chimpanzees, the apes, she could understand their natural behavior, their changes, their attitude, and how they respond to different factors. So this is how the different types of research methodologies, either by doing trials, either by just observation, by discussion, by interviews, or by um, just noticing the facts which is happening naturally, or by comparing two groups, controlled and uncontrolled trials, or therapeutic trials, or by just following up the patient from the start until there is emergence of any problem, longitudinal studies. Like this, various studies, just I gave an example of the previous history where the research, and this is evidence here. By taking this evidence, they could able to generate the research and come out with some conclusion which helped drastically in the many achievements were there in the medical field for development of vaccines, for development of new drugs, for development of new theories and new hypotheses. Okay, so this is how research plays a very important role when we come across the previous history of research. Similarly, the famous examples of research which was done, which nowadays it is proven, is oral contraceptive pills and the health. This study was done. And to understand what is the relation between the smoking and the lung cancer, the study is called as Dolan Hill study, which was conducted. Thalidomide tragedy. The pregnant mothers who consumed thalidomide, they had congenital malformations in the infants who are born after the consumption of this drug thalidomide. And I told you already, Framingham study, which helped in understanding the risk factors which are responsible for the cardiovascular disease. And the people, the occupational exposure of uranium and the emergence of lung cancer. So these things, these are the famous research studies, different types where there was understanding of association between the factor which was causative factor and the outcome. Nowadays, without evidence, just proposing a theory is not important. It is not considered as having any weightage. So the main thing, wherever you do research, always you should have evidence-based medicine or practice. This is the gold standard for any clinical practice. Whenever you have to apply any new method, any new drug, or any new method, any new strategy into your application for your work, or in your process of diagnosis or prevention, control, or any level, you have to have evidence-based. So evidence-based practice plays an important role in research. Now coming to the definition of the research. In the research, we can see here the research. These two words are here, in which re means again and again, and search is to find out something. This is just the understanding of the basic term of research. Research is the quest for knowledge through diligent search or investigation or experimentation. It is aimed at discovery and interpretation of the knowledge. This was defined by WHO, the definition of the research. So we are constantly searching again and again by various investigation or experiment, either in the form of discovery or invention, to understand the existing knowledge or to develop new knowledge. This is the research. So research comprises, it is defining and redefining the problems, formulating hypotheses, and suggesting solutions, collecting, organizing, evaluating data, making decisions, and reaching conclusions to determine whether they fit the formulating hypothesis or not. So this is the research where we understand what issue it is, why we have to address this issue, what is our area of concern, why we want to do the research in this field. Later, we develop one hypothesis, and then we try to find the solution by going through a process of methodology. After collecting the data, analyzing the data, then we will formulate our hypothesis, whether this is true or whether it is not true. So different people have defined research in different ways. Like Research is a process of collecting, analyzing, interpreting information to answer questions. Or it was defined by Redman and Mori as a systematized effort to gain new knowledge. Meaning of research method as a systematic plan for conducting research. So there is many definitions for the research. What is the difference between research and hypothesis? The research hypothesis is a statement of expectation or prediction that will be tested by research. The title, the hypothesis, for example, consumption of high salt food results in occurrence of hypertension. That is the hypothesis. Or taking high sugars, or taking or doing how many hours of exercise per day will result in the reduction of weight loss, like this. So the hypothesis is a statement which you want to test in the form by doing research. What are the characteristics of research? Characteristics are, research is not just without any systematic process. It should have a systematic approach. It follows a protocol. It has steps, and it should be following that protocol very strictly. And because if they want to prove evidence based and they have to prove their hypothesis, they have to follow this hypothesis protocol. And it is based on logical reasoning, where it can be inductive or deductive. Inductive, you can generate new hypothesis. Deductive, the same hypothesis, you can understand better the existing knowledge. So the data, whatever you can take for the proving your research, can be real time from your actual observation in your natural settings also. Not only from your data, you can, I'll tell you in the future, like what can be used for your daily work, which includes any documents, any records. Various types of data can be used. Even the natural settings can be used for qualitative research for observations to generate the data. In-depth analysis of the data collected so that there are no anomalies associated with it. Research will create a path for new questions, and existing data helps create opportunities for further research. And accuracy, that is validity, it is one of the most important aspects of research. The information that is obtained should be accurate and true to its nature. If this is compromised, the validity or the accuracy of the research data, then the research will not have any weightage, and it will be questionable. So the health research, it is the application of the principles of the research on health. It is generation of new knowledge by using scientific methods to identify and deal with health problems. So this is specifically health research. What are the ingredients? What we want to generate research? What ingredients do we need? First, we have to understand the issue. What is our area of interest? Why we want to do this research? Which topic? Why this topic? How you will do? When you will do? Which data you will use? All these questions you have to develop in your mind. The issue, why you are going to choose this research topic, all this. And then you can research design. And if you want to do this type of research, what will be your research objective? What will be your design? What will be your methodology? How you will collect data? How long you will collect the data? And what are your feasibility issues? Is it easy to access? What are the barriers? And what will be the study timeline? Do you need funding? Do you need budget? What are your ethical considerations? And are there any previous studies based on this? So all this research background homework you have to do before you start research. And benefit. Finally, once you are coming out of the research, does it make any difference with this research topic? Compared to the old studies, what is the new thing added on in your research topic, which helps the community or the participants or the people or the healthcare system by developing the research? So the objectives of the research before developing the research, when you choose the topic, should be clear. What should be your objective for developing new knowledge, and it does it help in the form of, it can help in scientific study of social life, for welfare of humanity, for classification further of facts, for social control, prediction. So there are many objectives which you have to understand before analyzing your research topic. The role of research, it is various according to the topic, according to your interest. The research can be used for assessment, or it can be utilized for policy development, or it can be just for assurance purpose, to understand whether it is competent or it is really working or not, to understand if the existing program or existing policies, guidelines, whether they are competent enough to control this issue. So when you do assessment, it is just to understand the situational analysis, current situation, just to monitor, just to understand the diagnosis process and the investigation. And when research can be used for policy empowerment, for information, for education, for empowering, for mobilizing community partnerships, and to develop policies, the research can also be used. Then further, to understand whether these strategies, whether implemented, whether they are useful or not, by understanding sure whether there is assurance in the workforce, by evaluation methods, by enforcing laws. So the role of research can be in various ways. It helps the researcher to understand where he can fit in his research, for what is the role of his research topic. Now, just today, I'll just brief you only the outline of the research process, because the construction of the research proposal itself is a different topic, which has to be elaboratively discussed in another session. So first, I'll just outline the headings here. The steps is identifying the problem. First, you have to understand what is the title for a research study, what is your objective, and what is your hypothesis which you are going to study. Based on the title, after you finalize the title and the topic, then you will start reviewing the literature. Reviewing the literature is you have to go back and search the at least 5 years before, whether there are similar studies conducted in the same locality, or in the same country, or in the another country, or in the different settings, or different type of population, so, or different gender, different age groups, so different occupation, whatever it is related, all literature review, at least minimum 5 years behind. You have to go back and look into the previous search of literature, previous articles which were published. That I will discuss here, how to look into the literature. This will help you to get an idea that what is already done and what extra you can do, or to compare the difference between your study and other studies which are already done. Or if it's a fresh study, it's not conducted, it can give you review to understand better, to add on extra facts. So after going through the literature, by going through various databases, then your objectives will be clear, your aim will be clear, and your hypothesis. So you have to make a short abstract, objectives, background, methodologies, and what will be your study period, study area, study population, all these things. And if you have any limitations in your study, that also you can identify with introduction, and ethical issues, budget, timeline. What will be your plan of work? How you will start? Within how many months you will be able to collect data? How you will able to do which methodology, sampling, then conclusion. What will be your timeline? And then referencing different articles and databases. And once you choose the study design, accordingly, you have to choose the evidence-based study designs, which I'll just now explain. Then after that, you have to estimate your sample size. The sample size, we have various formulas to calculate the sample size for different types of studies. And nowadays we have computerized methods also to estimate the sample size. And then start with collecting the data after following the approval with ethical issues. Then collection is done, then processing, then analyzing, and finally write the report and the manuscript. And also all this process, at every step you have to undergo review and testing, pilot testing, and discussion with your experts. So that will help you to correct at every level, at every stage with the help of the experts. So whenever you are making a research question, a good research question should have this criteria, which is called as finer criteria. That is, the research question, it should address these things. F is feasible. Feasibility should be there. It should be easily feasible, accessible, like a very relevant topic. R is relevant. It should be relevant, the research topic. It should be ethical, novel, interesting. So these are the elements of the good research question for any observational, non-experimental studies. But when you consider randomized control trials, the specific or any therapeutic trials or controlled clinical trials, usually whenever you generate a hypothesis or a question, it should address this useful tool, which is termed in the form of PICO. PICO is P-I-C-O. P means in the hypothesis, it should be addressing the population, the patient, the problem, the population whom you are going to study. For example, you are going to study the risk factors influencing the emergence of breast cancer among the women more than 50-year-old, 60-year-old. Like this, if you are finding out, then population, age group, which population, female, more than this age group, like this. And what intervention if you are doing in RCT, that is in randomized control trial, then you have to address that initiative like vitamin C tablets or after radiotherapy, after chemotherapy, and comparison with whom? With the other breast cancer patients, or with the other types of cancer, or with the smokers and non-smokers, exposed or not exposed patients, whatever factor you are going to study. And finally, what is your outcome? To understand better efficiency or better prevention, what happens when you do this research after going through randomized control trial. So these tool is important, and it is mandatory when you generate a hypothesis in the control trial type of studies. Yeah, when I was talking about the literature review, we have different, when you are searching the articles, you have to go through various databases. We have Cochrane library, there is PubMed index, articles, there is a database for PubMed, Cochrane, Scopus, Google, Scholar database. There are free open access articles available. You have to go in that website and search your article by typing some keywords. Whatever your relevant, your topic is. If you want to study the deficiency of vitamin D among women, lack of sunlight, then you can use sunlight, vitamin D, women, deficiency. Like this, some keywords you can use, and you can use and or then also you will get various search of articles. The number will vary. So when you use this kind of databases, you can use PubMed. Here, as you see, this is the home page of PubMed, where we have in here PubMed Quick Start Guide, full text articles, any questions, any tutorials, everything is there. Mesh terms is medical subject headings. When you type headings here, keywords, and search, you will get various type of literature reviews, articles according to your search keywords. So a brief explanation about the methods. As I told you, whenever you construct a research proposal, starting abstract should be there, a short explanation of the background, introduction, aim, objective, methods, and conclusion, and limitations, keywords. The proposal should cover always what will be your adopted study design, what kind of study design you will use, whether experimental, trial, cross-sectional, cohort, or just simple case series. What will be your study area, where you will study in the hospital or in the primary health center, or outside in the field, in the community, in the house, when you do the house visits, whatever is the area. Then duration, what type of population groups, among the males, among children, or different among the smokers, among the people who are consuming high fatty food or sugar food, different types according to your research hypothesis. And then you have to estimate what can be based on the literature review. You will understand what will be your sample size. You will understand the prevalence of the previous studies. Based on that, you can estimate by formula what can be your sample size, which is sufficient enough sample size has to be taken. So according to prevalence. Later, if the sample size is very small, then your results cannot be generalized. And there are various sampling techniques, random sample, non-stratified, non-random sample. So different that is there. And later you have to understand what can be your sampling technique to estimate your sample size. Then inclusion and exclusion, whom you will include and whom you will exclude, and what is your method for data collection, what tools you will use for data collection. Either it can be a questionnaire method or interview, or it can be open questionnaire, closed questionnaire. Open options are open to the people. They can give according to their mind, the options. Closed, you will give the options to them. Tools, different tools, if standardized tools are available, standardized questionnaires are available, you can use them after getting license. Finally, then data analysis, and then conclusion, and if any recommendations or limitations in your study. Also, the ethical considerations have to be covered inside the proposal. How you conducted the study, did you get approval from the ethical institutional review board committee, and are there any interventional or trial procedure, informed consent is taken or not, the issues like privacy, confidentiality, and the transparency and other ethical issues have been addressed or not. So all this has to be justified, and understand every step is very important here, and it has to be defined here systematically in the research methodology. Any step is compromised, then your study or research will have less weightage. Research, we have broadly applied research, basic research, quantitative research, qualitative research. Quantitative means it is numerical, because it is we can define, we can investigate in the form of numbers. Whenever we get any outcome, it will be in the form of numbers or quantifiable data by performing statistical mathematical technique. Qualitative, it is not numerical research. You are just doing observation. You can do interviews, focused group interviews, discussions, observations. After that, you generate a theory, and here it is non-numerical. So this is called as qualitative research. This is the difference between quantitative and qualitative. Examples for quantitative: cross-sectional study, cohort study, randomized control trials, and case series. Like this, we have different examples. Qualitative, focused group discussions, in-depth interviews, observations. So this is the example for qualitative research. Same here. So this is a structured data here in quantitative, unstructured data in qualitative. Here we do it by statistical analysis. Qualitative, we do it by summary after interview, after any discussion. Here we get conclusions objectively, numerical, quantitative. But here in the qualitative, we get subjective conclusions by interviews, focus group, observe. If we want to understand their culture, if we want to understand their attitude, practice related to some health issues, just by interviews and focus group, some their resistance of mothers, pregnant mothers, for getting vaccination for influenza. So for example, that time they can go and conduct interviews and observe and focus group interviews. What are the reasons for resistance? So this is not numbers here. Here it can be their opinions, attitude, beliefs. Whereas here it is quantitative. Like how many smokers after smoking, how many quantities of cigarettes, after how long of duration will they be having the risk of development of lung cancer. So like that, there is a difference between quantitative and qualitative research. This is just a table where it explains various types of research here. Primary, secondary. Primary, we have basic, where basic is existing, whatever is existing knowledge, we are further exploring it, the existing knowledge. Whenever we take this basic knowledge and apply it for the new procedures, new development of theories, then it becomes applied research. When we apply it to animal cell study for genetic studies, clinical trials, experimental, observational, epidemiological research. Already I told you there may be observational, experimental. Then we have case control study, cross-sectional study, cohort study, like this various types of research are here. Secondary research, already the research are done, and out of that we are again combining all the different types of articles and reviews, and then we are following a systematic process. Then we do statistical analysis, it becomes meta-analysis, systematic review, or traditional simple narrative review. So these are the different broadly classification of different types of research. As I told you, the evidence-based different types of study design. Here, these are observational studies, experimental studies, and these are the further critical appraisal review studies. The weightage increases from below up. The case series, expert opinion, cohort, they are less weightage compared to RCT, compared to critically appraised literature. The highest level of evidence-based research considered is for systematic reviews and meta-analysis. So just to understand the process of how the data can be, the data cycle, how we can effectively take the data, store data, preserve and reuse and document through a life cycle of data process. The data will be generated, it will be collected, then processed, stored, managed, analyzed, visualized, and interpretation. And later it will be communicated with the proper decision-making results. And data has to be presented also in the form of charts, in the form of graphs. So the data plays, this is the main raw material for our research methods. So whenever there is a research, identify the current data, what type of data you have to need, what will be your tool, what will be collection plan. Yeah. Then after aggregating the data, take action and display the data in the form of presentation, then analysis by following the different properties of data like validity, reliability, sensitivity, specificity. Then find out, interpret, take action, report the decision, monitor the actions, and communicate the results. So these are the data information management process steps. These are the very important qualities of data, properties of data. That is reliability. How reliable the data is which you are using for your research hypothesis. Even though you repeat multiple times, it should have consistent results. That is, your data is reliable. It is reliable also, and it is accurate also. That is, it is valid, it is correct data. Sometimes the data cannot be accurate, but it can be reliable. And sometimes it is not reliable or it can be accurate. But sometimes both it is not reliable or accurate. So these things are very important to be addressed whenever you are doing data collection and data processing. Why data quality is important? Data quality, if it is compromised, it results in wrong decisions, wrong reports, and bad reputation. Now, where can we find the data? Look into your daily working routine, into your daily process of work, where you are able to process data, where you are generating the data. Look into the ideas where you can find. If you are working in a hospital setting or primary health center or in administrative setup, whatever documents are there with the proper procedure, with the permissions, with the agreements, and with the intact privacy and confidentiality, and undergoing a proper review process, then you can choose whether you will use your medical records or surveys or any reports or direct observation or any like in the hospital infection control or incident reports or any external database reports, accreditation, any guidelines. Anywhere you have to search, you have to generate data, or you can develop secondary data from the existing records or primary data, that is from new idea, from interviews, from applying the questionnaires or going to field-based studies. Like that, you can generate the data for your research. So in the medical records are very commonly found in the hospital settings, in the primary health centers, where we have a lot of information related to the patients. If you follow the ethical principles related to their medical treatment history, related to what treatment was given, what is their habits, personal habits, based on their care, based on the patient identification, diagnosis, documentation. So various components you can see, and what is the issue, what is your aim and objective of the research topic. Based on that, you can choose the existing secondary data, medical records or health records for generation of data. Any medical record will contain many basic contents of the patient diagnosis, information, treatment plan, progress, medications, discharge, clinical observations. After discharge, they can see what are the reasons for rehospitalization or instructions, specific findings, what procedures were done, what is the post-discharge treatment, pre-operative care, documentation, emergency care. So many things are there which you can utilize here for the generation of your data for the research. So medical record always acts as a review tool. If it is open record, you can simultaneously see the patients when they are admitted. Usually it will be done by the staff for immediate feedback to staff can be here you can receive. Whenever the patient is discharged, if the records are closed, you can go back previously. After some years, you can close, when the records are closed, you can go back and again review retrospectively by using a multidisciplinary team for further action taken, what was done and what was not done, or what whether next step is to follow. Like this, you can compare different types of records for your data collection. Again, the medical record, it plays an important role for care, for timeliness, for completeness of treatment, compliance, for appropriateness of treatment, outcome results, timeliness, adequacy of medical record as communicative record. So a medical record is a very important data collection tool which can be used after going through proper permission and without revealing the patient's identity and identification details. Next, coming to whenever we generate a proposal or research, these are the very important issues which always addressed whenever you are sending it after you finalize your manuscript and sending it for the publication. This term is called as plagiarism. Plagiarism is you are exactly copying, cutting, paste in your article other sentences from other articles as it is. Just copy paste reference immediately after mention. This is not acceptable whenever it is published and it is from the other authors' articles or publications. So plagiarism has to be avoided. You have to generate your own sentence, rephrase, modify, take the ideas from them, take the values or numbers from them, but you have to generate your own words. So this has to be kept in mind to avoid plagiarism. Ethical issues, always the content of the study, whether it is honestly done, what is the study design, whether all the participants were equally treated, equally in the therapeutic trials or in the controlled trials. Whenever the participants are divided into controlled and not controlled trials, they have to be treated equally. There will be no injustice. If there is any weakness in the study, any limitation, and what is the source for this data, everything they have to be addressed in the article. So in the data management, the medical ethics plays a very important role. That is, transparency should be there. Whenever the study is conducted, it should be clear among the participant and the researcher whether it is beneficial to them or not. If it is not beneficial, at least it should not harm the participant, and it should be giving equal justice to the participants and the non-participants in terms of occurrence of disease or any outcome or any complication, especially when they do any interventional studies, any therapeutic trials where the drug or any procedure which is done during the research, it should not inflict any complication or any outcome to the participant. So everything should be transparent, and a consent has to be taken. Accountability, governance, proper procedures, guidelines have to be followed. Data should be accurate. Data has to be secured, and data sharing between the third party agreement, data sharing agreement issues, privacy, confidentiality. So these are the very important principles of medical ethics in data management, which has to be followed whenever you do any research, whether it is experimental or non-experimental. There is a National Committee for Bioethics in Saudi Arabia. Before you develop a proposal, always you have to clear this certification exam for the ethics, and after that only you, with the certificate, you have to submit your proposal for the research. There is Institutional Review Board in Saudi Arabia, where it has few requirements whenever you submit your research proposal before you are allowed to start the main research. That is, the research team has to be finalized, who are the investigators, and their CVs. And as I told you, there should be a valid research ethics certificate for all the investigators. Whatever tool you are using for data, or as a questionnaire or collection sheet, interview guides, all this has to be submitted. And the IRB required forms, there is application form, there is informed consent form, Arabic and English, data sharing agreement form, and if any sample collection is there, biologic sample outside care, then the form has to be filled, and non-disclosure agreement form, if applicable, has to be submitted for the proposal acceptance. So basically, whenever the data is there, the information management cycle, always it helps in application of the data information for the improvement in the quality, for planning, for improvement, for control, either by taking decisions, by understanding the data, we can interpret, and we can, after doing statistical analysis, collection. So it helps variously in the institution or in the administration level for decision making. So the research can have a very great impact on the quality improvement. It helps in advancing knowledge, professional development, skill enhancement, career advancement. It helps in the patient care, innovation, discovery. It is the very important gold standard for evidence-based practice. It enhances the teaching, learning, curriculum development, critical thinking, experience, hands-on, institutional reputation, prestige, helps in attracting talent, funding, grants, interdisciplinary collaboration, continuous improvement assessment, enhanced clinical skills. So research will constantly boost the new updates and new processes, skill development among the professional to continuously improve in their field. So research plays an important role to support decision making, to improve the patient outcomes, to improve healthcare documentation, to improve patient safety, to improve performance in patient care, treatment, service and governance, management and support process. So finally, I had told you the cartoon which was created by George Pinwell, and this concept here, it was generated by after the discovery of John Snow or the outbreak of cholera. This cartoon, this give importance of how the water pump, which was by the death dispenser, who was supplying the water which was contaminated by the cholera. So this was conducted by English epidemiologist John Snow, and after followed by cholera epidemic. They published this cartoon just to make the importance, to show how the research made a role in understanding the source of water as a death for the people who are consuming this contaminated water for infection of cholera. So I would suggest these books. There are various books. There are various online books or textbooks in the library or in the journals, articles, which are very much available nowadays by different authors for research methodology. So here are some few suggestions, like practice of social research is here. Then research design, for if you want to understand the qualitative, quantitative. Different authors are here who have mentioned different types of research, social research methods, qualitative research, case study research, Sage Handbook of Qualitative Research, research methods in education, introduction to the practice of statistics. So the various materials and books are available online and also in the bookstores. So you can just use guides, but WHO guide is also available for the research methodology by different authors. So you can refer and understand the basic concepts of research methodology and the different designs and construction of proposal, as well as next process of data collection, data presentation, analysis, sampling techniques, sample size, ethical considerations. So every issue is very much has to be studied elaborately, and it has to be understood detail. But it is a stepwise process. Once first you start basic research, start understanding what is your area of interest, develop the topic, take the title, make abstract, develop proposal, then step by step, everybody will understand the clear systematic process of research. So thank you. Any doubts?
Thank you, Doctor. I want to ask about cross-sectional study. When I can say this is analytical and descriptive, is it based on the statistical test that they use in the cross-sectional or based on the outcome?
See, I'll tell you, cross-sectional study itself, to explain, it will take another session, but just I will explain you a few points. Cross-section means you are not studying the whole. It is a part of it you are studying. Just it is called as a snapshot of the study. You are taking the snapshot. And in cross-section, whatever you want, just a part of it you are understanding. It is static. That's why it is called a snapshot. Only you can understand in the cross-sectional study is prevalence. You will understand what is the magnitude of the problem. Okay, for example, prevalence of hypertension in Tabuk region, prevalence of diabetes among the less than 10-year-old children in Tabuk region, like that. So prevalence-based studies are called as cross-sectional studies. In here, you can, the magnitude of disease you can know, the amount, when you consider this is a descriptive study only, you can understand what is the factors influencing the problem, what can be the risk factors, but you can't generalize. According to evidence-based pyramid I showed you, the cross-sectional study, it comes in the lower side of weightage. Okay, so only you can do prevalence-based studies in cross-section.
Okay, thank you. Doctor, for the literature review chapter, there is minimum number of citation for the articles or it's open?
Yeah, see, whenever you do research, maximum you have to try. For example, if you do very highly evidence-based research, like systematic review and meta-analysis, the authors will go through with the team actually many thousands of articles they can go for literature review, because they are filtering all the articles after going through process only, they will come out with the summary. That is for meta-analysis and systematic review. But for the other studies like observational studies or experimental study, there is no such limit how many really literature reviews you have to mandatory go through, but more the better. At least it should be 20, 30. So more the evidence you get, more the literature review you get better idea and clarity what you have to do and what is not done, what can be improvised. And when you do for publications, when you finally submit, at least they will specify sometimes in the publication, in the journals, minimum your references should be 30, not more than 30, not more than 40, like that. But it is not fixed actually.
Okay, thank you so much.
Thank you. Any more doubts? And somebody here, they have asked, there are CME hours. Actually, still till now, we don't have any CME hours for this session. If anything is there, we will update, inshallah. Okay, if there are no doubts, hope the take-home message today is think. Today, the best thing is at least think in your current settings, in your current work area to generate research. By understanding what is your area of interest, what is your hypothesis, what data you will use, and you can make research in any small way, either in the cross-sectional case series or just observation or interview based. So just initiate the process of research in your work process. Thank you so much for your participation. Assalamu alaikum.